Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. Thank you so much for joining us through previous episodes. This is a platform where research meets understanding. Today, I'm glad to bring on board a colleague from the eastern region of Africa who has done so much to me, who has done so much of good research and good work with regards to different aspects of health. Today we'll be looking at Ebola. This is the first time we are looking at Ebola on this platform, and also we'll be looking at the history of Ebola, where we are in Ebola currently, and the way forward with regards to Ebola. So please join me to welcome Dr. Edward Majani. Dr. Edward, did I pronounce Majani well, or is there another way of pronouncing it? Dr. Edward?
It is okay. It is okay. Okay.
Okay. Thank you so much for that. Before we go into today, we are looking at Ebola, as I said, in specifically in Uganda. Uganda is a country of interest to me because that's where I gained my undergraduate degree. And yes, I don't know if I told Dr. Edward before. Yeah,
Yes,
I
give me
spent
the
6 years of my life in Uganda. So when we're looking at Ebola in Uganda today, it's of interest to me because it's like a second home to me. So let's briefly give our audience an overview of Dr. Majani's profile. He is a distinguished global health researcher, editor, and leader with over 4 years of experience advancing research policy and community-based initiatives across Africa and beyond. He has authored more than 45 peer-reviewed publications in health systems, infectious disease epidemiology, and social well-being, demonstrating his commitment to evidence-driven solutions. He currently serves as a research scientist at the Center for Reforms, Innovation, Health Policies and Implementation Research, and managing editor of the Journal of Infectious Disease Policy. He is also a guest editor and former associate editor at the Journal of Public Health Research, CeRIHI Publishing, where he leads special collections on Mpox epidemiology. His leadership extends to youth empowerment and policy engagement, having served as Chief of Party for National Programs on Gender-Based Violence and Youth-Led Research under the Youth Health Action Network. He has facilitated multiple high-impact workshops and presented at leading scientific conferences. Dr. Majani is a yearly fellow, Michigan Fellows Africa Initiative Scholar, and recipient of multiple awards, including the Nutli Kapologwe Primary Healthcare Award. Driven by impact, Dr. Majani is committed to building resilient health systems, advancing health equity, and mentoring the next generation of public health professionals. Dr. Majani, that's a beautiful profile. I'm inspired. I'm inspired as a younger professional. Let me put it that way. I'm inspired.
Thank you very much.
You are my senior colleague.
Thank you very much. Thank you very much.
Okay, Dr. Majani. Usually what we do, we look at what people are saying about Ebola, about the topic of discussion on social media platforms. And specifically, I go to X because that's where majority of people have like a confidence in airing their views. So the first tweet on Ebola I got is from WHO African region, which is about a day ago, where they said the new Ebola treatment center in Bulape is now fully operational, equipped with 32 beds, including a 2-bed intensive infectious disease treatment model. This marks the first time WHO has deployed the innovation beyond simulation sites in Uganda and Ghana. 2 critically ill patients are already receiving timely saving care. The second is from International Federation of Red Cross, which I also work for. They said during Ebola outbreaks, teams face many challenges from misinformation and fear to poor infrastructure and disrupted livelihoods. That's why community engagement and trust are the heart of every effective response. The last is from also WHO, but the first was from WHO Africa, the third is from WHO, the main body. Following the Ebola outbreak in the DRC, WHO is launching a 21 million US dollar appeal to help the country scale up operations, interrupt transmission chains, prevent further spread, mitigate the impact on human health. And this is so good. I feel a lot of work has been done. DRC is the like epicenter of Ebola. I'll put it that way in East Africa and even in Africa as a whole. There's a lot of research going on there. Based on that, the man who is known as the Africa Ebola hunter, Professor Jane Jacques Muyembe, is a focal person there. I think there's a lot of research coming out from Congo to East Africa and other parts of Africa. So well done to Professor Muyembe and his team. So back to our discussion, Dr. Edward, this publication started based on an Ebola outbreak in Kampala. As I said, I lived in Uganda, so I cannot imagine being in Kampala when the outbreak started, where a nurse moved from Kampala to Wakiso, then Mbale. I lived in Mbale for 1 year. So when I read the story of this nurse that moved, I was like, why were you moving? My first thought was like, why are you moving? Then another thought is that, Azeezat, when someone is sick, you just want to get cured. It doesn't matter where you are moving from one district of Uganda to another. You understand? And also the fact that he also went to a traditional healer, that does not remove the fact that we as Africans, no matter how educated we are, when things get to the extreme, we're like, see, let us try our forefathers. So this man moved across across three hospitals and also tried a traditional healer before dying. Professor Dr. Edward, what are the publication started with a beautiful story of this nurse. So what are the three things you want us to know about the resurgence of Ebola in Uganda?
Yeah, thank you very much, dear colleagues. Greetings everywhere you are. It is my pleasure and my honor to be with you and to speak on Ebola specifically on Uganda, and I will touch a bit on African generally because speaking about Ebola in Tanzania, we have witnessed the same problem in nearby country. So I will speak generally in African general, but with the case study of Uganda. So speaking on the research of Ebola in Uganda, among of the three things that we can pinpoint of the fact that the situation happened some months ago. This year, February, the Minister of Health, the Uganda Minister of Health declared that 9 cases were confirmed that they are suffering with just an Ebola. So one of the things to understand about Ebola in Uganda, the first thing, this year, the research of Ebola is not just the first occurrence, but it make a quite of the chronicles of an event it happened. It is a now it is more than 5 times the same problem happened in Uganda. So the first and foremost must pose the question to us: why the resurgence of Ebola continue? Should we think about the clinical prevention? Should we think about the primary prevention? Should we come with any strategies maybe to come up with a really intervention, because it happened more than 4 times? That is this thing that we can ask ourselves. That is one. It poses a question to us: why again in Uganda? And initially happened in Kampala, and we realized later on it is, and we realize now it has been spreaded from Kampala and even Balale district. So you can realize that the problem is still rampant, not only in Uganda, but even it affects some of the nearby country. So that is one. And the another thing that we can pinpoint is a fatality rate of this particular disease. And the third is the ongoing challenge. You have already declared that there are some of the initiative and research that is ongoing on the prevention of Ebola so that we can make the difference. So the research of you Ebola in Uganda pose a question to us of all to think beyond our normal day routine prevention measures. It poses a question on how we can address these challenges. It reminds us our response strategies. It touches the surveillance aspect. It touches the vaccination aspect that we are going to dive more. So I hope after our conversation we'll clearly understand what does this resurgence of Ebola communicate in relation to the surveillance, in relation to the vaccine, in relation to the mitigation strategy. Thank you.
Thank you so much, Dr. Majani, for that beautiful beginning. You really set the pace for us to have a good foundation on our discussion today. Dr. Majani, we keep talking about Ebola concurrently in Africa. What types of Ebola disease have we experienced in Africa? Because I understand the current one is the Sudan virus. So, what types of Ebola have we experienced in Africa?
Yes, speaking about the type of the strain or species that we are experiencing in Africa generally, from the literature, six are known, but out of them, three are the most dangerous and most prevalent. So we have quite a number of them, which is six in total, what is known. But coming to the experience the field, we have main three viral that we are usually experience. So one of them is Ebola virus, which cause the Ebola virus diseases. Historical is among of the very deadly species, and sometimes it's called the Zaire Ebola virus. You can meet with another name, Zaire Ebola virus. That is one. And now currently we are speaking about the Sudanese virus, which give us a headache as a scientist, because it kind of trick to deal with just a Sudan virus, and it's what now in, even in Uganda they are facing the same species. It is kind of trick to come up with a vaccine or to mitigate to mitigate it. However, there are some of the research that are still ongoing to make sure that we come up. So that is the second species that we are facing. And also we have another one. It's called Budingibagona virus, which caused which had discovered most of the time. It was discovered in Uganda. Was discovered in 2 decades. Was 27 around 27 was discovered this type of virus. And the first species we have Thai forest virus. Also is most of the time it's not so much prevalent, but the main three viruses that I mentioned is what we are usually dealing in experience from the ground, and according to some of the outbreaks that has happened concurrent in Uganda and even some of the nearby countries. So general, the most prevalent are the three: one Ebola, Sudanese, and Gavi virus, which cause BVD, which was discovered in Uganda in 2007. Thank you.
Thank you so much for elaborating on the different types of Ebola strains we've experienced across Africa, Dr. Majani. Next is, what are three things you feel we should know about Ebola? This is different from the first case, the resurgence, and now Ebola itself. What are three things you want us to know about Ebola?
Sorry, come again.
The
I think
three
my
things.
internet.
Okay, okay, sorry for that. What are the three things you want us to know about Ebola? The first was about the
Yeah,
resurgence of Ebola. This is about Ebola.
yeah. Thank you very much. What I really wish the community to understand about cholera, the first and foremost, is just the transmission dynamic of Ebola, due to the increasing nature of the interaction between animal and human being. It gives us just an avenue for the spread of this particular virus through the direct contact, through the blood or just secretion or just organ or any other body fluid of an infected person or just alive or deceased, or with the surface contaminated with this fluid. A person is only infected when they develop symptoms. So they and the community to have the clear understanding of the transmission dynamic is of paramount importance to understand the interaction between a human or just a wild animal like bird that is spreading the human population through the direct contact. That is one. And another is to understand the symptomatology behind the Ebola. That you know in the field in epidemiology aspect usually focus so much on the surveillance aspect and even detection of the cases. So the community having an understanding on the symptomatology, first and foremost, an Ebola often it is non-specific, that is one, and it can resemble also with some others disease, can resemble as malaria, but because you find the patient may present with a sudden onset of fever, fatigue, or the muscle pain, and maybe next day or maybe followed by vomiting, diarrhea, and sometimes may complain about rashes, some cases, and sometimes internal just and external breathings. Um, so understanding the symptomatology and even the community to have the clear understanding when they notice that, and even to seek a medical care is of paramount importance so that we can having an error detection and even mitigate it timely. So the lastly, what I really wish the community to understand is to understand that Ebola disease are severe and often fatal. So, and it has been reported that the overall fatality rate is approximately 40% up to 50%. Um, and it depends heavily on the early case detection, identification, and how access to prompt and the intensive support care. Understanding the symptomatology, understanding how serious the disease is, understanding the interaction of animal and the human being is of paramount importance. So, and by having that a clear picture, it can help not only the community, but it can capacitate and help us to foster having an early case identification. Thank you.
Thank you so much, Dr. Edward, for shedding more light on that. I believe in our audience watching and listening are getting points on what to know about Ebola, the take home. That's why I say three, so that they can get easy points to assimilate. I know that, okay, this is Ebola. When they ask them about Ebola, when they hear Ebola anyway, they know, okay, these are the symptoms that might show up. This is what I know about Ebola. They have at least some knowledge on Ebola. So, Dr. Edward, I see you have a series of paper across Tanzania and Uganda. What can you say on the difference in healthcare delivery in both countries?
Yeah, thank you so much. Speaking about the healthcare delivery model, given these two countries, maybe let me start with Uganda, my fellow from Uganda, the power of Africa. So, speaking about Uganda healthcare system and their model, the healthcare system of Uganda is decentralized with districts that are responsible for most of the facility, except for the referral hospital, and it operates through a mixture of public and private, and then the private not for profit and the private for profit. It has that kind of dynamic. It has a private not for profit, which is substantial uh, have the proportion of kind of the 15% in the healthcare system, and even have the private for profit provider, which make 40%. And also we have just a mixture of public. We have a mixture of public, the public which make more, which make around 45%. So speaking about now comparison or just the quality variation across maybe Uganda and Tanzania, or maybe we can speak East Africa in general. So the quality, or just the services delivery model, it it has a special component which is specifically deal with this outbreak and emergence. For instance, in Tanzania, our model is kind of the same with the model of Uganda. However, for us, it is decentralized as well, but we have a specific unit that deal with the prevention and the Ministry of Health. So coming on how we tackle this problem, given our different mode of delivery, you will find both of the countries have a special desk and a cabinet that deal with the preventive strategies, and their models of healthcare provisions is likely the same and having the same strategies on how they usually tackle their problem. Thank you.
Thank you so much, Dr. Edward, for giving us that difference in healthcare delivery. Actually, from previous episodes, we've looked at difference in healthcare delivery in Uganda and also Nigeria. So I'm glad to give our audience a difference in healthcare delivery in Tanzania and also Uganda, looking at different countries at the health level. Um, in the paper, we know there is an outbreak currently. And WHO and other Ministry of Health are trying to tackle it. But in the paper, I came across outbreak, epidemic, pandemic. No, outbreak, I mean. So can you tell us the difference between an outbreak, an epidemic, and a pandemic? Because I'm sure we are still going to bring Dr. Edward, sorry, on future episodes. Um, and something that will be repeated is pandemic, endemic, outbreak. So what is different between these three? Because those who are outside the field of medicine, not even science, even just medicine, might be like, what are these terminologies? Are they Greek words? So what are they?
Yeah, thank you very much. Maybe let me start with the pandemic part, which is quite interesting. So, pandemic, in order to confuse more the audience, pandemic, someone can explain, is just an epidemic that has spread across. That is just an epidemic that has spread across a large region, can be a multiple continent, can be even globally, and usually affect a large number of people. And even this make the division to be more tough and harder, because the pandemic is just now and again an epidemic. Now, what does an epidemic mean? Speaking about an epidemic, often it can often the epidemic used interchangeably with just an outbreak. However, it usually refer to the large scale it refer to the large scale sustained outbreak within a region or just a country. Now, when you have that kind of an epidemic now that is spread across the region, across the multiple continent, even global at large, affect a high number of people, is what we call it pandemic. But epidemic, large scale of people within just a region or just a country. Now, speaking about the pandemic, now we are talking about the public health emergency that entirely affect the global scale. But the outbreak now, let us come to just an outbreak component, because we have witnessed a road now an outbreak, what entirely means. In a simple term, what I can say about outbreak, um, outbreak, it you usually refer just an increase, or just often happen sudden in the number of cases of disease above what is normal expected in a given population and in a specific area. So you can agree with me that an outbreak is often used for a more localized event. Now we have maybe an Ebola now. I'm working in a hospital, we receive a quantity number of patients that are normally an expected range, but in a given period of time and even in a given population, it happened. Maybe I'm doing maybe I'm working in a hospital, maybe at Timbarari, now receiving the patient at the same street, at the same region, or at the same compound. I receive a lot of patient with the same presentation, eh, given unexpected, often sudden, and now we declare now this just an outbreak because it's just an often event affect just a given number of people, or having a certain presentation that is not normal, that need an attention. Given what happened in Uganda, it happened, the patient presented fever, and later on fever, and start a sudden onset of fever, vomiting, and even the condition become worse day and day. And then after going the lab, we confirmed that this just an Ebola, and the case keep increasing. So the index, and even the index cases, and the case to be increased day and day, is what now we declare now this is just an outbreak. Thank you.
Thank you so much, Dr. Edward, for differentiating between an outbreak, an epidemic, and a pandemic. Just to top it up, we all know the COVID-19 pandemic. That's an example of a pandemic across countries. The Ebola currently affecting Uganda, DRC, that is an epidemic. Then an outbreak, an example, let's say in Bali as cholera outbreak, or maybe a FCT Abuja as an outbreak, or New York, if it happens in New York, a cholera outbreak, that's an example of an outbreak. So it depends on the people affected, and also the region it's affecting. So if you want to think of anywhere here pandemic, just remember COVID-19 pandemic, endemic, Ebola, outbreak, e.g. cholera outbreak. So I believe that seals it all for our audience. Moving forward, Dr. Majani, what has changed basically regarding management of Ebola virus in Uganda across decades? What has changed? Because I know Uganda has a history of recurrent Ebola cases. What has changed in the management?
Yeah, thank you. What I can say, what have changed in Uganda, let me remind the audience again. This is not the first time Uganda experiencing this occurrence. So this is the 60 times. So what have changed, I'm really happy that Uganda, they capitalize on the lesson learned from the previous outbreak, and make a significant improvement. I'm talking about enhancing the response capacity. So I'm so glad now Uganda are enhancing the response capacities. And once you deal with an outbreak, response capacities is of paramount importance. The country has built the capacity through preparedness effort, including expansion of the laboratory capacity for rapid detection of the viral hemorrhagic fever, and even establishment of the trained cadre of the health responders, and even emergency operation center. So this is among of the things that we are really glad now the Uganda took an advantage of the research that happened previous, so that to enhance the response capacities. And even their strategy, the response strategy, I'm glad they have already refined their strategies. Now that speaking about Uganda, this is not the first time to happen. So I'm so glad that Uganda took a full advantage of their lesson learned from the previous outbreak. So up to now, we have all of us, we can witness some of the improvement that has been made, more specifically on the enhancing the response capacities. And when you are dealing with an outbreak, response capacity is of paramount importance. Now the current has built the capacity through the preparedness effort, including the expansion of the laboratory capacity, and for the purpose of the detection of the viral hemorrhagic fevers, and even have established of the trained cadre of the health responders, and even emergency operation center. And secondary, they have already now refined their strategies. So the response strategies have been defined based on the lesson learned of the previous outbreak, including the early case detection and the isolation, the robust contract tracing, and even strengthening community engagement protocols. I'm happy now in this movement of addressing these particular challenges, no one is left behind, and even the community now, they have the community engagement protocol to make sure that if we are speaking about the PPI, the community understand about it, and the emphasis are put so that we can mitigate. The last three, on the infection prevention and control (IPC), the emphasis has been pressed on the need of an adequate PPE, the personal protective equipment, and the training for the healthcare workers following an infection rate among them is just an early outbreak. So that is among the things that we are happy now has significant improved in regarding to the Ebola in Uganda. Thank you.
Thank you so much, Dr. Edward, for elaborating on that. I believe even non-Ugandans, with your explanation, they understand the journey through the decades in the management of Ebola patients. Moving forward, Dr. Majani, what factors contributed to the resurgence of Ebola in Uganda in 2025? Funny enough, before
Yeah,
you answer,
so
funny enough, I saw the resurgence. The first case was January 30th, 2025. Because I'm very good with dates, I was like, oh, is this exactly like 5 years after COVID-19 pandemic started? When it was termed as a public health emergency of international concern. So, Dr. Majani, please, the floor is yours.
yeah, thank you very much. So speaking about the drivers, particularly on the resurgence of this year on Ebola. So ideally, among of the key drivers, as I mentioned earlier, is the close human animal interaction is what we are struggling with. So the close human animal interaction through the contact with infected wild animals can be through the infected wild animals through maybe hunting or just consumption of maybe a bush meat. It can increase the cross contact or just a human animal interaction that precipitate the transmission dynamic from the animals up to the human being. That is one among of the drivers. Second, we talk about the traditional practices. Most of we know the funeral of rites or just animals that involve the direct contact with the body of the deceased and who may be highly infected. So our traditional practice, particularly on the funerals, is what now exacerbate the transmission dynamic of an Ebola. And it's not only for this occurrence, but even when you make a critical examination of the past or just a previous and outbreak, will you agree with me? Our traditional practice as among of the drivers. Thirdly, we speak about the infection control. So initially, I speak about the personal protective equipment. Um, in healthcare or just in healthcare facilities, this lead to the infection of healthcare workers. Sadly, even healthcare workers are not left behind this particular transmission dynamic because of inadequate infection control, the use of inadequate personal protective equipment in healthcare facilities. It may cause also the transmission dynamic or it serves as among the driver. We have witnessed a lot of healthcare workers that are dying because of the inadequate infection control in their health facilities. Uh, Lastly is population movement. You realize that there is a high rate of population movement, such as in area around the gold mine or across borders, which can spread the virus to a new district or neighbor country. Speaking about Uganda, initially it started around the Kampala, and now we find even in Boro district, things are very worse because of the population movement. Remind you, diseases they don't have boundary, so they can penetrate everywhere. So the high rate of movement or high rate of migration or immigration is among of the driver that cause the transmission dynamic of this particular disease. So among of the contributing factor again is delayed diagnosing and even seeking care. Patient may experience sign, and even now maybe because of the poor seeking behavior or maybe inadequate and the knowledge aspect, people they can look for the nurse alternative instead of maybe come to this facility and even seeking further medical attention. So individual presenting with non-specific area symptoms seek care at the multiple or just less prepared facility that may delay an isolation and even increase the transmission dynamic. Remind you, once you know the case, it need to isolate. So when you delay to confirm the diagnosis and even taking care, you have a high chance to transmit to transmit to increase the transmission risk and even delaying an isolation. So it causes more harm than it is used. Thank you.
Thank you so much, Dr. Majani. As I said from the beginning, when I read the paper, I was like, I was imagining if it happened when I was in Kampala and the impact it would have had on me as a student, yeah, on academia. So, when you have a epidemic, a pandemic, or an outbreak, you look at the impact at every level on every sector: health, economy, academia, finance. You understand? So now, Dr. Majani, what is the impact of Ebola outbreak on the health of East Africans, especially Ugandans? How has it
Yeah,
impacted the
thank you.
health sector?
Yes, the speaking about the impact of Ebola in healthcare industry at large, it has just a significant impact. Remind you, first we start with it is high morbidity, it is high mortality. So and Ebola, given it is nature just an acute and severe fatal illness, uh, given the fatality rate of around 40 up to 50%. So the first impact, it caused a direct and even a tragic loss of the life of people, particularly among the healthcare workers. So we lost even the human resources because of this particular disease. And given the fact is that we have just a super scarce of healthcare workers, but again we are losing the healthcare workers because of this particular disease. That is among of the very serious impact this particular disease has brought. And second, we speak about the socioeconomic aspect. It has a significant socioeconomic disruption in a manner that an outbreak poses a major threat to the socioeconomic well-being of the people. It is because of the disruption of the direct agricultural activity, trade, tourism, because of the disease. Beyond the socioeconomic aspect, speaking about the psychological concern, the survivors and the family often face a both clinical and psychological after effect or distress, and sometimes may face the stigma within their communities given the nature of the disease. Now you can imagine how far this particular problem is serious. It is beyond the clinical aspect, it touches a psychological component. Now let us speak in a big picture. Let us speak in a regional wise. Let us speak in East Africa. We speak about the regional health security. We have working tireless to make sure that we achieve the health security agenda or just a framework to make sure that we have just an integrated way and a comprehensive approach to make sure that we prevent and address this particular disease. So in a regional health security, Ebola has communicated a lot. Due to the multiple cross-border activities and the travel pattern, outbreak in Uganda and even DRC pose a significant challenges and threat to the regional healthcare securities, requiring even and sometimes because of the nature of disease, it requires the neighborhood country to implement the readiness and even contingent planning so that they can be in a position to face the challenges when it happen. So all of them are among of the very serious impact, starting from the person, healthcare facilities, regional, and even the health security in large. Thank you.
Thank you so much, Dr. Majani, for elaborating on the impact of Ebola on Ugandans, on East Africans, especially Ugandans. I've seen series of information online on how ministries of health are responding to the Ebola outbreak, and with the help of the World Health Organization. How is the Ministry of Health Uganda specifically? How are they responding to this resurgence in 2025?
Yeah, thank you very much. So, speaking about the response strategies, particularly in Uganda, I'm happy that the response was rapid and even coordinated. That is what I can say. Was rapid and coordinated in what manner? We witness intensified surveillance and screening. And given the fact that this is not the first time, so in every outbreak, there is a lesson learned. So the lesson learned from the past and outbreak brought an intensified surveillance and screening. And that's why we don't have any no news now speaking about the continuation of the problem, speak the pattern and even the number of cases identified. So at that time, I witnessed an intensified surveillance screening. There was a training surveillance system and even screening for traveler at numerous point of entry and even some international airport. And all of these are done so that we can mitigate the cross-boundary transmission. Starting from the Kampala, Mbore district and others, we witnessed this particular surveillance system. And all of this was just to make sure that the case are area identified and even make sure that we mitigate timely. And also, speaking about the planning, I'm happy that some of the contingent planning was made. There was a review and updated country Ebola contingent planning and even building a lesson from different outbreak. And even the Ministry of Health page was updated and even come out and even speak about the number of cases identified and what is going on about it. So all of them are among of the response strategies. I like how the minutes first was coordinated and rapid response to it, coming outside and speak this is a number of cases and even alerting the community that we have this particular problem and even sharing the do's among the community members. And we need to be keen of this particular disease, and now these are preventive strategies. Again, speaking about the coordination and alert, there was just an activating the public's emergency operation center to active monitor the situation and even coordinate with a partner like WHO. And even after that happened, and even WHO are chipping to make sure that we achieve the agenda. Speaking about the preparedness training, Uganda hosting a joint stimulation exercise with other East Africa's country and even conduct a full-scale national stimulation to strengthen emergency healthcare response capacities, particularly in area like the case management, infection prevention, even the safe barriers. So that is among of the very promising response strategies, despite of some of the shortcoming on the resource mobilization and even the limited resources sometime, but at least they managed to come up with the coordinated and the rapid response strategies given the situation they faced during that time. Thank you.
Thank you so much, Dr. Edward, for that. And kudos to Uganda Ministry of Health for putting us such great strategies to help combat the Ebola outbreak. And special kudos, shout out to my colleagues, for my colleagues from Abib Medical School, who are working now in Uganda. Shout out to you and other colleagues from other medical schools in Uganda, Makere, Mbarara, Gulu, and the rest who are working in Uganda and helping combat the Ebola outbreak year in, year out. So from last question for you, Dr. Edward. Do you feel Uganda as a country in East Africa is ready to tackle the next Ebola outbreak without any mortality? You feel the next outbreak, there won't be any mortality in Uganda? You feel we have seen enough, we are ready, we are prepared to tackle the next Ebola?
Yes, thank you very much. It's among the very a tricky question, but what I can say, it is not possible to state definite that Uganda is ready to tackle the next outbreak without any mortality. But what I can say, we have witnessed some of the strength, and we have witnessed some of the inherited challenges. So in every outbreak, there's a lesson learned. So having a quite number of series of lessons, we do hope that we are going to improve, and even to make sure that you are ready for the you are ready in case of outbreak preparedness and even emergencies. So I would speaking about the strengths of their readiness, what I can understand, what I can say that Uganda has repeatedly demonstrated the high capacity for a rapid and coordinated response. And this is due to the fact, due to the long-standing expertise, established infrastructure that are there, and even the continuous preparedness exercise. So the country quick containment of the given that strength now, given the standing experiences, given the established infrastructure up to now, they can be in a position to tackle or just to tackle the next outbreak without any mortality. However, we have some of the challenges when you once addressed, we can confidently say now we are ready to fight the battle. Are we winning or are we losing? It depends how fast and how better we are going to tackle or to deal with the challenges. Speaking on Ebola, now we have just a Sudanese strain that is common in Uganda. Uganda is facing a Sudanese strain which has a highly inherited cause fatal rate, is around 50%. And even the research is ongoing concerned with the vaccination. It's a bit challenging up to now, even with our modern supportive care, still the current lack of approval of the vaccine or proven treatment for the sudden virus mean that achieving zero mortality remain just an ambitious. And achieving zero mortality mean an ambition an extent that because we are speaking, we don't have just an vaccine. At least maybe could be another strain that we know that maybe we have just maybe a vaccine about it. But Uganda, they are dealing with the Sudan strain, which is common, and the fatality rate is palpable around 50%. Is a high figure. Now, the current lacking of an approval vaccine or proven treatment for the Sudanese mean that achieving with zero mortality is nearly impossible and the potential unrealistic. So let us keep doing research, and this is a call for researchers and even the coordinated approach so that we can come up with the solution. Another thing, even the success metrics, how the realistic goal of the high lethal disease like just an Ebola is the rapid containment and minimization of the cases and death, which Uganda has historically achieved relative to some other country outbreak, but not elimination of the mortality completely. So given the Uganda capacities and event dynamic, it is still a challenges, but that pose a question: are we winning the battle? Are we losing the battle? But once we capitalize in research, coming with a vaccine that offer just a primary prevention to prevent. However, We need a coordinated and rapid response, strengthen our surveillance system, case detection. Whenever happen, we should be in a position to make sure that everything is in place. Speaking about the human resource, speaking about the other resources as well, speaking about the PPE and other force. But currently, what I can say, achieving uh, achieving zero mortality, it remain an extremely unrealistic and near impossible given the nature of the strain we are dealing with. However, research are ongoing. Probably, who knows, maybe tomorrow we can come with a new invention. Everything is possible, but for the current status, it is near impossible to say we can achieve. It is still unrealistic. However, research is going. Thank you.
Thank you so much, Dr. Edward Majani. To be sincere, I was smiling all through because I know my audience are eating good. When I mean eating good, they are getting the right information and they are getting it just the way I want it to be simplified. Thank you so much, Dr. Majani, for giving your time, your knowledge to this platform. God bless you abundantly. And our dear audience, we looked at Dr. Majani's paper on the resurgence of Ebola in Uganda during the week. Please, if you've not read the paper is as sweet as this discussion. So please go back to read the publication. Actually, the publication analyzed the factors contributing to the recent Ebola resurgence in Uganda. And also in the paper, he and other authors extensively discussed the access to effectiveness of they assess the effectiveness of the response strategies employed and provided recommendations for improving future preparedness and response efforts. So this is a paper I feel everyone outside the field of science should read. Every student in the field of global health should read. Every medical student, everyone in academia should read, because we add the COVID-19 pandemic, which really exposed the health sectors of different places, the global north and the global south. And Ebola outbreak keeps is recurrent. It keeps coming up every now and then in health discussions everywhere, especially in Africa. Nigeria, we're expecting any case. We're expecting to see if we have any case in Ebola. The DRC has recurrent cases of Ebola, which I feel I keep calling the epicenter of Ebola virus in Africa. And Uganda currently is facing other cases of Ebola. The WHO is working tirelessly to make sure they curb the Ebola outbreak in Africa. So this is a paper I feel everyone should read to get informed. You should know basics. What are the symptoms of Ebola? How does one present with Ebola? Where are we in Ebola? Where are we going to in Ebola? Not just in Africa, but also across the world. So thank you so much, Dr. Edward Majani, for giving your time once again to this platform. And I'm optimistic with this, we'll be able to improve the well-being of current and future global citizens. So have a blessed week, everyone. I can't wait for you to see our next guest. Yes, and also to make you happy, Dr. Edward is also going to be one of our recurrent guest researchers on this platform. So have a blessed week, everyone.